Coming up, President Biden calling on Congress to lower prescription drug prices as part of his Build Back Better agenda. Eli Lilly and Company CEO Dave Ricks is here to talk about the potential impact on funding research and innovation in Indiana and beyond. And the Purdue Foundry launching a competitive business building initiative called Boost. Managing Director Bill Arnold explains how the 10-week program can strengthen businesses. Plus,
I'm Mary Rachel Redman. Behind me, the beautiful Indiana Landmarks headquarters, still standing thanks to her. I'll have part 2 of my sit-down interview with former First Lady Judy O'Bannon coming up.
Details on those stories and much more ahead on this edition of Inside Indiana Business. Hello and welcome to Inside Indiana Business. I'm Gary Dick. It is estimated that Americans pay 2 to 3 times more for their prescription drugs than people in other countries. Nearly 1 in 4 struggle to afford prescription drugs. Now, the Biden administration wants to lower prescription drug costs by allowing Medicare to negotiate prices. But what could that mean for consumers and companies like Eli Lilly and Company? For some answers, I'm pleased to be joined by Lilly Chairman and CEO Dave Ricks, who's coming to us from Lilly's corporate headquarters in downtown Indianapolis. Dave, welcome to the program.
Thanks, Gary. Great to be on today.
Well, let's talk about this. Essentially, as part of the Biden agenda, healthcare agenda, that would allow the government to negotiate Medicare pricing. The administration says, hey, it's going to lower prices, which is needed. You and others in the industry say this amounts to price controls. Explain.
Yeah, that's right, Gary. What's being proposed now is an alarming policy shift as part of this reconciliation package, the president's agenda, which we oppose. We agree that Americans pay too much out of pocket for their medicines, but we don't agree on the reason. We feel like here in the U.S., because of a market-based pricing system for drugs, we've been able to, over the last, in my career, attract really the bulk of the industry's investment into the United States. Now, 80% of all R&D dollars in pharmaceuticals are spent in the United States. Almost every major pharmaceutical company globally has a presence here. And the benefits of that are not just on jobs and growth of our economy, but also on our ability to produce innovation when it matters most. And that was on display, I think, during this pandemic, where 5 out of the 6 approved drugs to treat COVID are American inventions, and all 3 of the vaccines we have are from American companies. So I don't think that's an accident. It's because we have this great industry. But that's supported by a market-based pricing system that allows innovation to capture value, and then we reinvest that value into future R&D projects. That's how the system works. Yeah. What's broken is what patients pay out of pocket, but we see that as an insurance design problem. And so we'd like Congress to focus on that problem, not really breaking apart the innovation model that's been built up so carefully here in the United States.
Yeah, this is a fluid situation, of course. We don't know exactly how it's going to end up. But as you look at the situation now and this pricing issue and what the administration wants, what, in your view, could be the potential impact for the industry, but specifically for Lilly, 10,000 employees here in Indiana?
Well, what we all agree on is that we should change the benefit designs so that patients' percent of the drug cost comes down. And I think consumers agree with that, all businesses agree with that, and the administration agrees with that. We'd like to start with the Medicare benefit for seniors, and the industry is willing to help pay our fair share to improve that benefit for America's seniors. But what's been proposed by the Finance Budget Committee, led by Bernie Sanders, and now in the House, is something well beyond the cost to fund that change, but extracting roughly $700 billion with a B over the next 10 years from the U.S. pharmaceutical industry and using it to invest in other programs like electric battery subsidies and community college support. Those might be fine priorities, but in doing so, funding that out of our industry, you're really going to destroy the American innovation system that has really created this gem of our economy. Lilly's an example of that. And I think viewers here know, the company's been doing well. We're thriving here in Indiana. And a cut like's being proposed would have about a 40% reduction in our U.S. revenues. There's no way we could just absorb that. We would have to make significant changes to our operations. The most important being reducing our R&D spending. This year, we'll likely spend about $7 billion on R&D, and those are for cures and treatments that don't exist yet. Unfortunately, we'd have to cut that pretty dramatically, and that means less growth for the company in the future and fewer jobs, probably locally, as well as fewer cures for the diseases of tomorrow. And we think that's just the wrong path.
Okay, Dave, only have about 40 seconds here, but as you look at the state of the company now, how things are, I know as we were talking off camera, you are looking at potentially growing, expanding. That includes here in Indiana?
Absolutely. We're at an exciting place because we've been able to invest in R&D. Today's medicines support tomorrow's cures. And we've been productive. We've got new medicines coming for obesity, for diabetes, for cancers. It's an exciting time, and we would love to grow the company here in Indiana. That won't be possible if this big Build Back Better package goes through. So we want to let everyone know, let your Congress people know you're not for that supporting innovation in America is important. And Lilly enjoys the benefits of that. We'd like to keep building here in Indiana.
The drug pricing issue continues to be a hot-button issue on Capitol Hill and beyond. Dave Ricks, the CEO at Eli Lilly and Company. Dave, as always, thanks for joining us.
Thanks, Gary.